Okay, welcome to this lesson today. This is a lesson on the Commonwealth of Learning, and we are bringing all the way from Coast Institute of Technology. It's a course in Certificate in Social Work. The course itself is Community Health and Nutrition. To bring you this lesson today is Mr. Kipkemoy Arap Tanui, and so I welcome you today. In today's lesson, we are going to look at nutritional disorders. And by the end of this lesson, we should be able to discuss and explain the causes of and symptoms of anemia. Anemia, as we can define, is a condition rather than a disease itself that results due to a dysfunction in the body. The condition indicates the lower than normal levels of red blood cells or hemoglobin in the body. Red blood cells, as we know, are used in hemoglobin that is supposed to be used in carrying oxygen around the body, which then turns to perform its various duties in our bodies. On the other side, the lower levels of hemoglobin and red blood cells causes the blood supply insufficient amount of oxygen to the tissues. This will force the heart and the lungs to work harder so that they can actually pump the additional oxygen to the areas where they are needed in the tissues. There are many different types of anemia. And the first one we are going to look at is iron deficiency anemia. This is the kind of anemia that occurs when the body runs low on iron, which is mainly due to inadequate dietary intake, diseases such as gastritis and stomach cancer, as well as also is caused by menstruation. The second type of anemia is what we call pernicious anemia, or vitamin B12 deficiency anemia. This kind of anemia is caused by inadequate absorption of vitamin B12 from the diet. Vitamin B12 is normally obtained from animal food sources, and so it places vegetarians and vegans at higher risk of developing this kind of pernicious anemia. Pernicious anemia can also be caused by diseases that affect absorption, such as stomach cancers, ulcers, and small intestine diseases. The third type of anemia is what we call megaplastic anemia, or folic acid deficiency anemia. This type of anemia is usually caused by excessive alcohol consumption and inadequate intake of dietary folic acid. Causes of anemia. Anemia generally is caused by a number of factors. One is what we can refer to as autoimmune disorders, when there is malfunctioning immune system in the body of an individual. The second cause is blood loss, which is most often caused by heavy menstruation, trauma, surgery, and diseases generally. The other cause of anemia is bone marrow disorders. Other one also is chronic diseases and infections. The other cause also is dietary deficiency, such as low dietary intake of vitamin B12, iron, and folic acid. The sixth cause of anemia also is medications. When we use drugs such as antibiotics, anti-inflammatories, and anticoagulants, we are likely to develop anemia. The other cause also is hormone disorders. Inherited disorders also is another cause. There can also be causes such as malabsorption or conditions, and also rapid growth periods such as experience in puberty and pregnancy. Symptoms of anemia. The first symptom of anemia is abnormal food cravings. Second one is appetite loss. The third symptom also is difficulty with concentration. Dizziness is another symptom. Fatigue and weakness is another cause. Fainting and headache also are other symptoms. Generally also there can be other symptoms including heart palpitations, irritability, orthostatic hypertension, rapid drop in blood pressure upon standing from lying or in sitting position, pale skin, reddened or cracked tongue, shortness of breath, among others. Then we have to discuss about the food that are needed in order to overcome challenges of anemia. The symptoms of anemia can be resolved when the body is nourished with additional amounts of iron, folic acid and vitamin B12 that are sourced from a balanced diet and supplementation. If iron is a richer source of iron to the body as it's more available to absorption. The following are some of the foods that are so rich in iron and which is recommended to every individual who has anemic conditions or symptoms. One is beef. Beef liver is also important. Chicken liver is also useful. Then fish, pork liver, pumpkin seeds, beans, baked potatoes are also good sources of iron. Then there is also a category of food that enhances iron absorption in the body. This includes oranges, cantaloupe, strawberries, grapefruits, meat, fish, poultry, broccoli, Brussels sprouts, as well as also tomatoes. In as much as we are fighting challenges of anemia, we are recommended not to take the following food because they hinder the absorption of iron in the body. Tea is one, coffee, chocolate, and also alcohol. These foods or these items are not supposed to be taken when we are suffering from anemia. Then we have to learn also about the issue of iron supplements. Along with a good dietary plan, health practitioners normally recommend iron supplementation to treat symptoms of anemia. When taking them, actually it is important to remember to take them on an empty stomach for optimum absorption. We are also supposed to avoid taking them with foods that may inhibit the iron absorption. And the following is the list of the items that we are supposed to discuss. Actually, food supplements delay the ingestion of other medication for a few hours after taking iron supplements. And so iron supplements are important food source of iron which are necessary in our diet. In the coming lesson, we shall be looking at other condition called obesity. And up to that time, we are grateful. Thank you.